What sex therapy is actually depends on the client that's come for therapy. Sex therapy takes a person's individual problems and needs into consideration, just like every other form of therapy. Although, in this case, in every situation, when it has to do with sex therapy, everything has involved some type of issue related to sex or sexuality. And it's important to recognize that there is, in fact, a difference between the two. And that's something we'll discuss in a later episode. But believe it or not, everyone understands sex and sexuality different. And if you think about it, I'm sure that you know plenty of people who have completely different views of sex than you do. Even among your friends and family. So you can imagine that people come for sex therapy to help with a wide range of issues. And we'll look at a few of these examples of what sex therapy is or why someone would come to sex therapy. So the first example I have for you is a gentleman who has had his prostate removed. So he had prostate cancer and he had to have his prostate removed. And he may come and seek after a sex therapist. He comes because he's no longer able to have an erection. And this leads him to believe that he can no longer please his wife sexually. Think about that. If you've been married for 10 years, 20 years, 30 years, you wind up with prostate cancer, you have your prostate removed, you can no longer perform sexually with intercourse, and you think you can no longer please your wife. You feel like less of a man. And so you have all these misconceptions of you feel that you're not a good husband anymore. You feel that maybe your wife will go find other companionship. So you have this internal struggle, what's going on with you, and these feelings of self-worth. And then you also have this fear in your relationship of what your spouse is going to do. So during the course of therapy, focus is often placed on helping him regain his perception of self-worth and having a proper perception of self altogether. And as a therapist, I would help him to explore ways of achieving an erection if possible, or orgasming. So how could that possibly be? There are sometimes medical procedures that could be done, or there are some sex toys that may be helpful. And I would also help him to reconsider ways that he could learn to please his partner sexually, so he feels he's still able to contribute and have an intimate relationship with his spouse. Another example of someone who would come for sex therapy is a woman who perhaps was sexually abused or raped. And so she could come to therapy for a number of issues. The most obvious of those is to help her deal with the abuse and the rape that she experienced. This includes helping her to cope with the experience and deal with any negative feelings that she may have as a result, or any flashbacks or other problems that the trauma has caused. And because this experience is connected with intimacy, she may have trouble being intimate with partners. And this is something that sex therapy can help with. And in this context, the therapeutic process would focus on helping her to overcome the traumatic experiences and to ensure that it doesn't affect her future sexual experiences with her partners of choice. And so in instances like this, when the client comes, they not only have emotional issues and psychological issues and obviously fear and trauma. I mean, these are serious issues that could, that not only affect her as an individual, but could affect her, if she's in a relationship, it could affect her ability to be intimate in that, or even fearful of developing relationships because she knows that she has these issues and this difficulty in being intimate with someone. So sex therapy can help in all of those areas. Also, you would see that couples come to sex therapy for a number of reasons. They may be bored sexually. They may feel that they have lost romantic feelings for one another. One partner may be wanting to explore areas of sexuality that the other partner is not comfortable with. They may feel that they have different desires and wants. You know, people change. Our bodies change, our wants change, our likes and dislikes change over time. It's not just with sex, it's with food and music and movies and whatever it is. These things change over time. And if you've been in a relationship for a long period of time, and you may have even heard people say, well, he's changed, or she's not the person I once dated. Well, neither are you, right? We all change, and change is a good thing. And so in therapy, in a situation like this, it's important to help the couples learn to interact again in a way that's very similar to when they first start dating. You know that feeling when you first start dating someone and you want to learn everything there is to know about this person, and you want to spend so much time with them to get to know them and to find out their likes and their dislikes and ways to please them. And that's something we can do in therapy when a couple's been together for a long period of time and have discovered that they both like different things than they did when they originally got together. And therapy can also, in this situation, for couples, it can be used to help open up communications so that couples can learn how to discuss their wants and desires. They might be fearful of telling their spouse or their boyfriend or girlfriend, something they want to try sexually. And they're fearful of how their partner would react. And so therapy can be very helpful in helping to open up that communication in a very safe and judgment-free environment for them. And sometimes when couples come, we also give them homework that would help them rekindle their romance. Obviously, you're probably thinking, homework in therapy, like what are you giving people to do? And this really depends. This depends on the couple, depends on, whatever problems they're having or whatever needs they're having in their relationship. It can be very wide ranging, from setting up date nights or trying to find ways for each of them to do romantic gestures towards one another, because that's very important to have romance in the relationship. Of course, passion is very important in a relationship as well. And so, we may find ways to help them rekindle their passion. And, if they haven't been intimate in a while, scheduling, they might come and say, we're so busy, we don't have time for sex. And it's finding the time and making that something that is a regular part of their relationship again. And it doesn't end there, Other reasons people come to sex therapy include things like premature ejaculations, difficulties achieving orgasms, difficulties with arousal, sexual disorders, sexual dysfunctions, coping with STIs, LGBTQ issues, and of course, basic relationship issues that a lot of people go through.